Anxiety, what it really feels like, and how to calm it fast. Hi, my name is Obi, a nurse who is passionate about mental health and addiction recovery. If you have felt trapped by anxiety, you are not alone. I remember one time I was still on orientation as a new nurse, and I was floated to a unit that I have never been before. While on the shift, the alarm ceased to go off, and all of them were all off at once. Everything was just going unplanned. I was so confused and scared. My heart was running fast, all because I was scared. I was ashamed that I would make mistake. I did not want to make mistake. I remembered I learned a lot of skills while still on orientation. I asked my preceptor, who advised me that I should take everything one step at a time. I took a deep breath and I said some positive affirmation. And then I started walking one step at a time until I was able to answer off all the alarms. Guess what? At the end of the shift, I was able to manage all the patient safety well. What does anxiety really feel like? Anxiety is a persistent feeling of dread, a sense of impending disaster, tension, or constant worrying. This feeling can stem from a variety of sources, and it manifests differently in everyone. Anxiety disorders are one of the most common mental health disorders in adults, affecting over 40 million people in the United States. There are three main pathways that are contributing to anxiety. One of such pathway is the biochemical pathway. The biochemical pathway focuses on long-term biochemical imbalances that can make someone more prone to anxiety, unlike acute stressors. These biochemical factors don't change quickly, whereas the acute stressors changes quickly. What are the causes of the biochemical pathway? One of such causes is diet and digestion, like digestion of malabsorption impact on amino acid. When amino acids are not well absorbed, they can in turn disrupt neurotransmitters balances. Another cause is neurotransmitters abnormalities. Neurotransmitters abnormalities can lead to chronic state of anxiety. The number two main pathway contributing to anxiety is the fight and the flight pathway. The fight and the flight pathway is being triggered by past trauma. The fight and the flight pathway, they connect to the body's nervous system response to anxiety. The third main pathway contributing to anxiety is daily stressors pathway. Managing everyday stress like cortisol caused by chronic stress, and this can be managed by lifestyle changes, adjustment, and mindfulness and relaxation techniques. All these can manage daily stressors pathway. What are the 10-minute practical calming tools I need for my anxiety. One of such tools is guided breathing technique, also called the box breathing. The guided breathing is a simple breathing technique that is done like every hour in a situation where you have to count 4 times. You hold your breath on the count of 4, and then you exhale on the count of 8. Another practical way is quick grounding exercise. The quick grounding exercise, like what we talked about in the last episode, is the 5-10-3-2-1 method, where you have to mention 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Another thing, what are the daily nurse approved anxiety routine? One of the daily nurse approved anxiety routine is the morning rituals. You have to hydrate yourself. You have to stretch, do some stretching exercise. Daily affirmation. Midday anxiety check-in should be mini breaks, journaling, or a walk, a 10-minute walk, a 30-minute walk. Another routine is the evening wind down, where you have to limit screen, a gentle music, prayer, or even meditation. You may ask, when do I need to seek for help? You need to seek for help when there is a red flag. Red flags about anxiety, when the red flags example is when anxiety is interfering with your sleep, or anxiety is not making you walk, or is interfering with your walk, or even with your relationship. You can also seek for help when things are not going the way you're supposed to be going. You are encouraged to reach out to the doctor, a therapist, or even a support group. You should know that asking for help is strength and not weakness. You need to ask for help when you find out that you can no longer do it anymore. A quick recap on what we have talked about today. We have talked about understanding anxiety and tools to calm it fast. Comment below with one anxiety strategy you will try today. Subscribe to my channel, NurseObi, for more mental health and addiction support. Together, we break the stigma. Turn on your notification bell and please share with your friends and family. Thank you so much. I'll see you in my next one.